Welcome to the Trauma app. In this demonstration, I am going to document a paediatric trauma case, highlighting a number of key features to show you how to use it in your hospital. The patient journey begins with the pre-alert information. The ED department at a major trauma children's centre received a standby call informing them that a 9-year-old male called Adam has fallen approximately 15 feet out of a tree house, landing onto another tree stump. The time of injury was approximately 1 hour ago. The ETA is 10 minutes. He is arriving via ambulance and is complaining of chest and left arm and wrist pain. His respiratory rate is 41 breaths per minute. His saturations are 91% in air. His heart rate is 139 beats per minute. Blood pressure is 115/72 and his GCS is 15. He has received IV paracetamol for pain and no other interventions are reported. Moving on to the preparation screen, the ED department decide to activate the full major trauma team. The nurse in charge is notified along with reception and the consultant is present. The team begin to prepare the resus bay by preparing the trauma mattress and other equipment they anticipate to need. As the major trauma team arrives, the following members of the trauma team arrive into the resus. Alan is our ED consultant and therefore in charge of the case. Ben has arrived for airway and anaesthetics and has been supported by his colleague Martin. Betty and Laura are the ED nurses looking after the patient. Darren has arrived for plastic surgery. Fred and his colleague Eric are going to be the ED doctors conducting the primary survey. Gary will be our scribe, and Harriet and Igor have arrived for surgery and orthopaedics. Once the team have arrived and are all booked into the trauma app, they anticipate the patient's arrival. Moving on to the handover section, once the patient arrives into the department, the time of arrival is documented. The patient has the following observations, so 46 respirators per minute. His oxygen saturations are now 89% in air. His heart rate is 135 beats per minute. His blood pressure is 119/68. His GCS is 15 and his temperature is 36.2 degrees. The paramedic crew has informed the team that Adam has a cannula in his right ACF and he also has C-spine protection of block and tape. He has also arrived to the department on a scoop. The paramedic crew start handing over Adam's history. He has no known allergies, he does not take any medication, he has no significant comorbidities. His mum stated he last ate approximately 3 hours ago, but she is unaware when he last had anything to drink. The primary survey is split up into 6 sections according to the ATLS procedures. Starting with catastrophic hemorrhage, the team identified that Adam has no signs of catastrophic hemorrhage. He has been removed from the scoop so that the team can examine him better. Moving on to airway, one of the ED registrars assesses Adam's airway and assesses that he's awake and crying, but he does appear breathless. The ED registrar, however, does note that Adam's trachea does appear to be deviated to the right. Moving on to B for breathing, the ED registrar progresses onto the breathing assessment and auscultates Adam's chest and finds that his right lung has normal air entry, however his left lung has reduced air entry. There are no signs of any open wounds on the chest and no signs of cuts or bruising on the right hand side. However, on the left hand side, there is some evidence of bruising and tenderness. The nursing staff have applied monitoring equipment to Adam in the interim. His saturations remain at 89%, however, they have now applied oxygen. His respiratory rate is 42. His heart rate is 141. And his blood pressure is 113/71. Based on the information that the team have identified in the breathing assessment, the team are concerned that Adam has a tension pneumothorax and therefore proceed to a needle decompression. This has been conducted under aseptic technique and was performed by the general surgeon within the team. This was performed on the left side of Adam's body and the outcome was successful. The team are now happy to move on to circulation. During the circulation assessment, the surgical registrar completes an examination of Adam's abdomen. Adam complains of tenderness on his left side and flank. However, there is no evidence of bruising. The nursing team undertake a capillary refill, which is 3 seconds. Based on this information, the ED consultant asks for a 10 per kilo bolus of normal saline. This has just been administered. The ED consultant also asks for a second cannula to be inserted in order for trauma bloods and trauma lab tests to be undertaken. This will include a U&E, an LFT, a glucose, a full blood count, a cross match and group and save. The ED consultant also decides at this point that CT imaging is required of Adam's chest, abdomen and pelvis. Moving on to D for disability. The ED consultant asks for a disability assessment, and although Adam has remained awake and is crying, therefore his GCS is 15, he has been unable to confirm or deny any head or neck pain. A pupil examination was conducted and both pupils were reactive and each pupil was approximately 4mm in size. Based on this information, the ED consultant is happy to move on to E for exposure. The ED consultant is made aware that Adam's blood glucose result is back, which was 6.8, which was considered normal. His temperature has been 36.3. However, due to being unable to rule out any significant head or neck injury, a log roll was not attempted. In addition to the chest injury that the team are already aware of, the ED consultant identifies a left wrist injury. Following the completion of the primary survey, the ED consultant decides to take Adam through to CT. So using the movement section of the trauma app, the team move Adam to the location of CT. The ED consultant completes the ED transfer checklist, ensuring that the transfer is safe for everybody involved. And once Adam arrives in CT, the correct time is logged. Now that the patient is in CT, the imaging request can be updated. The time the scan was performed is entered, and whilst the scan is being undertaken, the scribe can also input a new set of observations. To do this, they would click on the section of the vitals and start entering the time and the result. In this case, Adam's respiratory rate is at 40 breaths per minute. His oxygen saturations are now 95% in oxygen following the needle decompression. His blood pressure is 112/75. His heart rate is 136 beats per minute. His GCS remains at 15 and his temperature is 36.4. The team can now see from the Pew's chart that Adam is pewing a score of 4. Following the completion of the observations and the CT scan being completed, Adam is moved back to the A&E department, and this is captured within the movement section of the trauma app. The team then decides to commence the secondary survey. This allows the team to catalogue any injuries that Adam has, and first of all, they identify a probable fracture to Adam's left arm. They suspect that he has a possible radius fracture, which is closed, and a possible ulnar fracture, which is also closed. They also identify some bruising on his lower leg as well. Following the completion of the CT scan, the radiographer telephones the ED department and informs the team that Adam appears to have a splenic injury. On discussion with the general surgery team who were present in the trauma call, the team decide that Adam should be admitted to ICU for observation. During the preparation for admission, the ED consultant and the scribe review the report to ensure that all the information is correct so that a successful handover could be made with ICU. Within the document, the ED consultant notices that a piece of information has been missing from the cannula intervention and updates it accordingly. The patient is now ready to be moved to ICU and ready for discharge out of the ED department. Now that Adam is prepared for admission, the ED consultant progresses to the discharge screen. The case details have been updated and the ED consultant ensures that Adam's first name and surname and national patient identifiers are correct. The ED consultant isn't concerned that there are any child protection issues and has been able to update the family screen, informing the document of who attended with the patient and who has parental responsibility. Adam is being admitted to ICU, and so this is entered into the movement screen. The ED consultant enters the final notes. Adam has been admitted to ICU under the care of general surgery. Once this has been completed, the ED consultant will discharge the case. They will read the sign-off confirmation and continue to press sign off. And Adam's case has now been discharged and uploaded into his electronic patient record or printed off.